Despite billions in expected revenue, the Social Health Authority is still struggling to meet its targets, with health officials raising concerns over low registration, particularly from the informal sector. This has led to delays in payments to hospitals.
We still have a huge challenge with the amount of revenue that SHA is collecting, and that still goes back to the issue of the model in which we are onboarding the informal sector, self-employed people. We have raised concerns about the model, the proxy means testing. We know that the government is aware that proxy means testing is keeping a lot of Kenyans away from contributing, and that is affecting cash flow at SHA.
During a caucus involving the Rural and Urban Private Hospitals Association, it was noted that despite President William Ruto's directive for hospitals owed over 10 million shillings to be paid immediately, the order has yet to be implemented.
We believe that the president was unambiguous when he said that those claims that were over 10 million shillings should be settled, and he gave an unambiguous timeline for settlement of other claims that are above 10 million shillings. So we are hopeful and we are waiting for this, and we know the Cabinet Secretary is up to task. We hope that other state departments, including the National Treasury, will be able to support the Ministry of Health by ensuring that healthcare resources have been appropriated meaningfully.
The authority is also under pressure to upgrade its database, with some cadres such as clinicians still struggling to get fully registered under the system.
When we say a particular category of healthcare workers are allowed to provide services under SHA, if their database is not okay, if their regulator does not have a digital database connected to the Health Information Exchange, which is then connected to SHA, which is then connected to us, they'll be allowed to do it by the rules, but practically speaking, they'll have no connectivity and no visibility.
In a bid to address these gaps, the government has further appointed Dr. Mwangi as the new SHA CEO. She takes over after a competitive recruitment process led by the Ministry of Health, succeeding former CEO Robert Ngasira. Dr. Mwangi brings over 15 years of experience in the health sector, having served as a senior director at AMREF and as a health CIS during the COVID-19 pandemic.
And we are here in Africa.
Gertrude Burgay, K24 TV.